We are going to get started in just a few moments. I just want to take time to say thank you all so much for joining us for another episode of Wellness Wednesday with Dr. Latoya Wells. This week, or this month, shall I say, we will be discussing breast cancer or wellness awareness. As we know, October is Breast Cancer Awareness Month. And so this month, we're going to focus on all things breast care, breast cancer, talk about some statistics, talk about screening, just many different things this month. I want to also leave some space and take a few moments or some time to honor those who have dealt with breast cancer, have been diagnosed with breast cancer, have family members who have been diagnosed with breast cancer, honor those who are no longer here due to breast cancer. And so to start off my live tonight, I just want to take some time and space to honor a few people that I know personally that have lost their life to breast cancer, who have dealt with breast cancer, and we can say they are a survivor. And just a few words of comfort and encouragement to those who are battling breast cancer now. I struggle to find words to truly encompass all of my feelings and my emotions around this disease. As a healthcare provider, I see cancer of many different kinds, and I've taken care of patients who have been diagnosed with different disease processes and things of that nature. When we look at the statistics around breast cancer and the impact that it has on women as well as men, and the significant impact that it has on certain minority groups, the numbers can be astounding. And as a healthcare provider, as a woman, and as a woman of color, with a family history of breast cancer, this is always a month and always a disease process that I struggle with. And because I'm so passionate about educating my community, my family, my friends, when it comes to breast cancer, I can't stress enough how important it is to get screened. Tonight, I want to honor several individuals that I know personally who have made an amazing impact, such an impact on my life from the time I was a little girl until now. And so I will just say their names tonight. I lift up my Aunt Gloria Stevenson. I honor and recognize her tonight. I lift her name up. She lost her battle with breast cancer over 19 years ago. And the impact that she had on my life was one that I truly cannot put words to. She believed in me when I didn't believe in myself. She exuded such amount of strength and faith, and she instilled so much in me as a little girl, a teenager, that I'm so grateful that I had an opportunity to experience her. And I'm so grateful for my cousins for sharing their mom with me. And so today, and not just today, and not just in October, do we honor her, but we take time and space to speak her name. I want to, sorry guys, I want to say my grandmother's name, Clay Whitehead. She was diagnosed with breast cancer and was a survivor of breast cancer. And going through that process with her was terrifying. And I'll share with you guys a little later why. Not just because my grandmother was diagnosed with breast cancer, but because then that also puts my mother and my aunts at risk for being diagnosed with breast cancer, and potential for me and my children, my daughters, to be diagnosed with breast cancer. I want to speak the names of a few women that I know personally who have dealt with cancer and who are still here. And some of the strongest women that I consider: Marshina Jones. She's a mentor to me. She is a phenomenal and amazing friend. And I just want to she's not on social media, and I don't know if she will see this message, but I just want to take some time just to honor her and her strength, and just say thank you for being you and for fighting and continuing to fight and to educate our community and just being there for those who have gone through the same thing that you've gone through. I want to also speak the name of a really good friend and sister. Melissa Wilson is a breast cancer survivor. I'm sure we can spend days and hours speaking the names of individuals whose lives have been impacted by this cancer and this disease. But we're going to focus on some positive tonight. I just wanted to just take a moment and some space at the beginning of this live to speak their names. And another individual who impacted me and who I feel her life was taken way too soon. Michelle Reynolds was another individual whose life, her legacy, her strength, and just her presence impacted me, and lost her life to breast cancer. And so I think about her family, I think about her children. And so I just want to give you time and space right now to just think about those who you know personally whose lives have been impacted by breast cancer. Breast cancer diagnosis is not the end all be all. The key is early detection. The key is screening. The key is knowing your body. The key is getting help sooner rather than later. There's a saying out on the streets: if you see something, say something. If you find something, say something. If you notice that something is not right, go get help, reach out, talk to somebody. There's resources that are available, and we'll talk about some of those later. But I want to just give one major resource is breastcancer.org and AmericanCancerSociety.org have a great deal of resources and information that's available to us. There's so many grants that is available for women who don't have insurance, so that they can get mammograms for free and get the screenings that they need. Every woman should be completing a breast self-exam every month. And I know there's some studies and some information out that says, oh, you don't need to do that. Things kind of change. The method in which you perform it may be a little different depending on the resources that you look up or that you find. The key is to know your body, know what's normal for you, so that if something is abnormal, then you'll be able to know that. All right. So some statistics on breast cancer. In 2023, an estimated 297,790 women will be diagnosed with breast cancer in the United States, making it the most common cancer in American women. And that's just in the United States. If we think about all of the other countries and we take those numbers and add them up, the numbers are overwhelming. However, worldwide, breast cancer is also the most common cancer among women, regardless of their race and their ethnicities. The how we get into when we look at the different races and I can't even talk, ethnicities. Certain groups are at a higher risk for being diagnosed with a more aggressive type cancer or being diagnosed at a later stage. And so what are the things that we can do to screen for breast cancer? Early detection is key. So mammograms or mammography as it's known, every woman should have a mammogram starting at age 45. However, some women start as early as age 40. It all depends on the family history. So if you have a family history of breast cancer, your provider may decide to start you getting your breast exams, your mammograms earlier than that. After the age of 55, it's recommended every 2 years. There's been some controversy here recently on the changing of the timing of breast cancer screenings, such as mammograms. Breast self-exam, which is the clinical breast exams. Let me go back. Clinical breast exam, or CBE, should be performed every year starting at age 20 by your healthcare provider. So your clinician, your provider should be on each physical exam every year, be performing a clinical breast exam. They should be providing you with education on how you yourself will complete the breast exam at home. The breast exams, again, there are some recommendations or some studies that say it's not recommended. However, I will continue to say, know your body, perform the breast exams. You'll know if something is abnormal. And I've had patients, and I know individuals personally who their significant others found their breast cancer. And so sometimes our partners, our significant others, our husbands know our bodies, our spouses know our bodies better than we do. And so if something is abnormal, it's important to go get checked and get screened. Some individuals get their screenings annually around the same time. I typically get my mammograms done every year in February or March, late February, early March. So it's important to, whenever you're getting your physical exam, typically they will then give you a prescription for you to go and get your mammogram done. Genetic testing is important, especially if you know you have a family history, because there is specific cancers that are genetically based, or if you have that gene, it puts you at a higher risk for developing certain types of cancer. So if you have the BRCA1 or the BRCA2, genetic testing will pick those up, and then you can have conversations with your healthcare provider. My glasses keep falling off. You can have conversations with your healthcare provider, and they can talk to you about the risk versus benefits of potential surgeries and different options that they can discuss with you. When we look at further statistics, and I have my notes, we already know that breast cancer is the most common cancer among women, regardless of their race and ethnicity. In the United States, invasive breast cancer and over 49,000 cases of a new non-invasive breast cancer will be diagnosed in 2023. We're already in October of 2023. So just think about the number of women whose lives have been impacted by breast cancer. Breast cancer is the leading cause of death related to women after lung cancer. Breast cancer is something, like I said earlier, it's not the end all be all. And so just because someone has a diagnosis of breast cancer doesn't mean that it will end in them dying or passing away from it. It just depends on their clinical picture, how early it was found, the type of breast cancer, and things of that nature. So the importance and the key is early detection, early detection, early detection. And when I mentioned earlier about the breast self-exam, you doing your own exams, there is some controversy or some, studies that state that those aren't recommended, but I stand by them. And the reason being is I found a lump in my breast by doing my breast exam, and it was benign. It was not cancerous. I have something called fibrocystic breast disease and dense breast tissue, which puts me at a higher rate of inconclusive breast screening results, so mammogram results, because my breast tissue is so dense and because I have fibrous tissue. The mammograms alone aren't the best clinical screening for me. I also have to get ultrasound. So I'll have a mammogram and then I'll have an ultrasound in the same day. So I've had 2 biopsies. There are women, and this is very common, dense breast tissue as well as the fibrocystic breast disease. And so our screening looks a little different than a woman who has non-dense breast tissue and does not have the fibrous tissue within their breast. And so screening will look different depending on the individual. For family members, for friends, for women groups, whatever, your sisters, your village, let's pull together and remind each other every year to get those breast exams, just as well as any other health screening. But in the month of October, we are highlighting breast cancer awareness. There are many walks. There are many things that are going on around celebrating the lives of women who are survivors of breast cancer. There are many events going on that are setting time aside to honor those who have lost their life because of breast cancer. And so it's important. Again, the key is screening, early screening. Regular mammographies or mammograms can help early detection, as I mentioned earlier. And the American Cancer Society recommends annual mammograms, and we talked about that. The use of 3D mammography or mammograms has become more widespread and improved the accuracy of cancer detection. So there's so many different avenues by which we can get screened for breast cancer, but the key is to get the screening. And if you have not had a mammogram, if you don't know what you need to do, if you don't have a primary care provider, we have resources available to you so that you can get the screening that you need. Treatment advances. There's so many advances that have been made when it comes to treating breast cancer. And before it used to be, you just get, many individuals, women decide to have their breasts removed. And not every breast cancer requires you to have a mastectomy. It just depends on the type of cancer. It depends on the risk factor, your family history, things of that nature. So those are questions and discussions that women should have with their healthcare providers based on their history. So what are some things that we can do? Maintain a healthy lifestyle. We've talked about several times here that individuals who are obese are at a higher rate of developing cancers, and that does not exclude breast cancer. So eating regular healthy diets, exercising, limiting alcohol intake can contribute to good breast health. Know your family risk. Having those conversations, having those conversations with your family members and talking about what's in your family DNA, your history when it comes to medical conditions. There's so many of us who don't know what is in our family, what is in our bloodline, in our lineage, and having those conversations can help. Have those conversations early can help. Go to that elder in the family. Have those conversations. Start taking notes and writing things down. Get the information on your genealogy while you have those resources available to you. So understanding your personal risk factor for breast cancer, knowing what your family history is, at what age were they diagnosed with cancer, what hormonal factors, were they before the age of 50, or were they younger when they were diagnosed with breast cancer? If you have a family history and you have 9 aunties who were diagnosed with breast cancer, that's significant, and that's something that needs to be taken seriously, and meaning that you should be getting screened more frequently and earlier for breast cancer. One of the things that we don't want to do is ignore the signs and symptoms. Something could be really wrong and we can brush it off as, oh, I was working out today and that's why that area is sore. Or I bumped into, I've heard so many different things when it comes to women and the reason and rationale for why they don't get screened for breast cancer. There are so many different types of breast cancer. And if you're on Facebook, I posted a image of the breast cancer ribbons. And that's something that I did not know, that there's different types, different color ribbons for breast cancer, depending upon the type of cancer, breast cancer it is. And so I'll kind of go over a few of the different types of breast cancer. The most common is ductal carcinoma in situ. This is a non-invasive cancer where the abnormal cells are found in the lining of the breast duct, but they haven't spread outside. And this is considered the earliest form of breast cancer. And with this type of cancer, they can usually go in and do a lumpectomy, where they remove that lump or that cancer and a little bit of the surrounding tissue, and the women typically do fine. Then you have invasive ductal carcinoma, and this is the most common type of breast cancer. It accounts for about 70 to 80% of cases. And this begins in the milk ducts, but then invades the surrounding breast tissue. So as far as the non-ductal, the ductal carcinoma in situ, that one is enclosed. That cancer is enclosed. They can go in and do a simple lumpectomy, remove it, and the individual is fine. With the invasive ductal carcinoma, that cancer has spread beyond the milk duct into surrounding breast tissue. And it is still possible to do a lumpectomy, just depends on how extensive that cancer has spread within the breast tissue. Then you have invasive lobular carcinoma. You have inflammatory breast cancer. You have triple negative breast cancer, which is a subtype of breast cancer characterized by the absence of estrogen receptors. And that's a whole lot of words, but it's basically hormone, it's fed on hormones, what have you. And so that one tends to be more aggressive type of cancer. Then you have the HER2 positive breast cancer. And this is where the individual have an excessive HER2 protein, which is a rare protein that is found in these individuals at a higher rate that puts them at risk for developing breast cancer. Then you have metastatic breast cancer, where the cancer spreads to other cells within the body. And so now you have breast cancer, but it spread to the lung and the liver and the brain and things of that nature, other organ systems. And then, of course, we know there is also male breast cancer. So if you are a male, even though it's less common, it is a potential. And so if you are a male and you have a family history of breast cancer, then you should be getting screened as well, genetic testing under certain circumstances. I'm not saying that every man who has a female aunt, what have you, or their mother with breast cancer has to get screening for breast cancer, but it is important to have those conversations with your healthcare provider. As we go throughout the month of October, we typically wear pink to honor and celebrate women. Tonight I have on a shirt that says, yes, women can. Women can do anything. And it's evident by me watching and witnessing the women that I know go through and fight breast cancer. And so I found it really befitting to wear this shirt. Yes, women can. And as family members and friends of women, we should be encouraging them. We should be pushing them. We should be having those conversations with them to ensure that they're getting the help that they need, that they're getting the help that they need, and that they're getting the screenings that they need. So if you're watching this live, if you see this on replay, and each one of us, I'm sure we have somebody. There's a woman in your life that you're close to, who you talk to. Ask them, when was your last mammogram? And if they can't say that it was within the last year, we need to be making sure that they go and get their mammogram, that they are scheduling their mammograms. And then we're going to follow up with them, because we want to make sure that the women in our lives are healthy, that they're taken care of, that they're getting the healthcare screenings and care that they need. Because many times as women, we tend to neglect ourselves. We put everybody else first. Time out for that. We need to be high up on the totem pole, just like the rest of our family members, because if we're not healthy, how can we create and leave a legacy of good health for our family? It's time out for us women putting ourselves last and doing everything else for everybody else. And then we're worn down and we're sick in the end. It's time out for that. We weren't created to do it all by ourselves. And so someone listening to that today can make an impact on someone that you know by encouraging them to get their mammogram. Call up your sisters, call up your friends, have those conversations with them. You're going to see pink all throughout the month of October. But once October ends, we shouldn't stop having these conversations. This should be an ongoing conversation that we're having with our friends and our family members. I had my mammogram in February. It was negative. My screening was negative. Ask those questions. Some people are very private. They don't want to share that with you. You don't have to be that intrusive. Me, I want to know all the tea. I want to know, did you have your mammogram? What were the results of the mammogram? Do you have your next one scheduled? Typically, they will schedule that mammogram for you, at the time that you have that one done each and every year. Just like we celebrate our birthdays, let's make sure we're celebrating our health. Just like we go out and we get our hair done and we make those appointments, make the appointments for the important screenings that we should be getting, not just as women, but as individuals who want to and are actively creating a legacy of good health. This is Dr. Latoya Wells. I am a family nurse practitioner and owner of Wells Legacy Health and Wellness. I want to say thank you all so much for joining. I appreciate each and every one of you. I lift you guys up, those who have family members who are dealing with breast cancer now. It's a journey, and the individual that's going through breast cancer is impacted, but so is the family members. And so reach out. There's support groups available. There's help within the community. We're here to help. The number for Wells Legacy Health and Wellness is 321-306-6755. And so if you need help, if you need assistance and you don't know where to go or what to do, reach out to us. I have an amazing announcement, and I said that I was going to let you guys know. We are having our grand opening on October 21st. I will be posting some information, though, if you want to stop by and join us. We'll be there celebrating the grand opening of Wells Legacy Health and Wellness. We have new services coming. So as we get all those things up and everything ready for that, we'll be sharing it here with you all. Again, I'm so grateful for each and every one of you. Take care, stay safe, and be well. Do what you need to do to help yourself and your family create a legacy of good health. We do that here with Wells Legacy Health and Wellness by taking time to make sure that you have the education, that you have the knowledge to live your best life, your best, healthiest life. I'm going to change that up a little bit. All righty, we'll talk to you later. Until next time, bye.